Hi guys, welcome back to our channel, and I am Anne, now Maka, and this is Michael, there, right there. Say hi.
Say hi.
Yeah, for today's video, we're going to talk about the Medicare. By the way, before I proceed, I just want to introduce Michael. Michael is for those new to our channel. Michael is a retired American here in the Philippines, and he's been here for 2 years. And in this video, we're going to talk about the Medicare for American, retired American under by retired, yeah, retired and for disability. And my issue here, I just want actually I cannot understand why Medicare insurance, health insurance in America, he cannot use it here in the Philippines, even though he's paying it every month. How much is it? 4,000.
It U.S. cost this year is $174, and it'll go up.
Four thousand.
Yeah, no. It's about it's closer to 8,000.
8,000 a month.
8,500 a month.
See, it's kind of like I was like thinking it's kind of like wasted because he's paying it every month for 8,000, and then any single peso he can't use the Medicare here in the Philippines, you know. And then since he arrived here and we went to his surgery in the Premier Hospital, he cannot use it here. So that's why we decided to apply a Philhealth here in the Philippines, the Philhealth insurance. And yeah, he's able to use a Philhealth insurance because he has a ACR card. If you haven't watched that video, I'm just gonna put the link down below in our description box, or I'm just gonna put it right here. It will gonna pop up, and just click it right away so that you know how PhilHealth it works for you if you are retired here in the Philippines, and then if you are same situation with Michael using Medicare. And yeah, so in this video, Michael will gonna share to you his experience about the Medicare here in the Philippines, because I don't know those stuff, and Michael will gonna explain it to you step by step. Okay.
Okay. First, let me apologize. I need reading glasses, and I wrote a little kind of disclaimer to emphasize about what I'm going to be talking about. And I'm going to read it so I don't misspeak. Basically, this video is only for those who are on the American Medicare system and are not former American military. There's other options for veterans who were in the U.S. military, and those options are accepted in the Philippines. There's a VA hospital in Manila, and I think there's a hospital in Cebu. But in any case, I'm not experienced in the military aspect of health insurance, and I don't feel qualified really speaking about it, and I'm not going to here in this video. You can search other YouTube videos that deal with American veterans' health insurance, and you're going to get better information than what I can give you. So, and also the following options and opinions that I'm going to be giving it may not be for everybody. This is others might experience different results. They might find other options that work better for them than the ones I'm going to discuss. But what I will be discussing is strictly from personal experience, and it's only to be received as a guideline and not, an absolute option for what to do. Okay. Now we got as most people, Americans who are considering coming to the Philippines know, Medicare flat out cannot be used in the Philippines. Medicare can only be used in the mainland United States, Alaska, Hawaii, and most of the United States territories, Guam, Puerto Rico, and so forth. Okay, so and we're going to be covering what do you do because Medicare is not here. But the other thing I also wanted to say, we're talking about Medicare, which is the federal insurance, and not Medicaid, which is independent state welfare assistance. And I also want to say that if you are dependent on Medicaid for your medications, for your health costs, and things like that, not Medicare, but Medicaid.
Is that different?
Yeah, Medicaid is basically state welfare.
Oh,
it's
okay.
like if you make so little money that you can't afford anything, you can apply for Medicaid, and Medicaid will help pay for costs that you can't afford. It'll even pay for some of the Medicare premium. And the part I was going to say is, if you are extremely dependent on Medicaid, I would seriously do a full evaluation on whether or not coming to the Philippines is actually going to be beneficial for you or not. So everything we're talking about is strictly Medicare.
Okay.
Okay.
So is that same company, Medicare and then Medicaid?
Well, Medicare is not a company per se. It's the United States federal government. Medicaid is entitlement program. It's welfare programs that is each state in America has a different Medicaid program, which helps with with health costs if your income is below a certain level,
Okay.
or it helps children, things like that.
So Medicare is different. I mean,
Medicare is
it's
different.
like a private agency, private sector.
No. It's also it's why it's hard to compute. Medicare is the federal government. Now, there's plenty of other insurance companies that are private in America, and some of the people viewing may be able to use those over here in the Philippines, but I can't address any of those. I can only address what my situation. Okay. So now that we realize that Medicare is not accepted in the United States, what do you want to do about it? There's several options that you can take into consideration. Option number one is, to be quite honest with you, just accept it. Medicare is not accepted in the Philippines. I can't use my Medicare in the Philippines, but I'm going to keep Medicare just in case of some catastrophic event that should happen and I have to return to the States. I still have health insurance in the States. That's one option that you can do if you choose to do that. Okay. Another option is, it's an option that I originally took, was to look for Advantage plans in your zip code that will help pay for some of the premium on Medicare. For example, when I originally moved here, I had moved my mailing address to Nebraska because I had a very good friend who was going to help me with mail and things like that. And I applied for an Advantage plan there, and the best plan that I could find would pay an additional $37 a month on the Medicare premium. So my premium that time was $165. They were paying $37. So my premium was $129, I think, a month. It lowered it $37. So that extra $37 came into my Social Security payment at the beginning of the month. When my friend, his health took a turn for the worse, and I realized that he was going to no longer be able to assist me on some of the mailing issues I had in the country, I went ahead and moved my mailing address back to Georgia, and I applied for Advantage plans there, and I was able to find a plan in Georgia that pays $100 out of the $174 this year. So I only pay $74 out of pocket for Medicare, and $100 comes back to the Social Security payment at the beginning of the month. But zip codes differ, as you can see, from Nebraska to Georgia. It's going to depend on what your zip code will do. Some zip codes will pay almost nothing. Some zip codes pay nothing. And there's like 4 or 5 zip codes in the United States that will pay the entire premium. I don't know which zip codes those are, but that's something for you to look at to see, an Advantage plan that'll help pay for some of the premium, so you get some of that Medicare premium back. The company that I use to help find the Advantage plan is called the Medicare Family. That's the Medicare Family. Just Google it; they'll come up. They had agents who were able to help me figure out what I needed, explain to them explicitly my situation, and they were able to assist in finding the right Advantage plan for me, both in Nebraska and then when I moved my mailing address back to Georgia. Another option is by using a postal service like ipostal.com. You can maybe go through different Advantage plans with different zip codes in the country. Find the zip code that's going to give you the most advantage, and physically change your mailing address to that particular state. It's legal to do. You can do it. It's a mailing address. All your information will go to that iPostal account. They scan it. You're able to access your mail that way. And then you don't have to worry about what's going to happen to your physical mail. You can tell them to shred it after you read it or whatever. So trying to find an advantageous zip code in order to get some of the premiums back on an Advantage plan could be an option as well. Now, once I got here and I was getting some of my premium back, and I'd been here at least 6 months, and as Noel mentioned, I had gotten my ACR card. I have an ACR I card, which basically is a Alien Certified Residency card, I think is what it stands for. I was able to go to Philhealth. They realized I'd been here for longer than 6 months. I applied for Philhealth. It was 17,250 pesos for the first year, and that's about $320 US a month. $320 US a year, not per month. $320 for the year, and I now am covered through Philhealth. The first time we used Philhealth, as Noel mentioned, I had to get laser retinal touch-up surgery in my left eye. I had some blood vessels that were forming, and if they did not cauterize those vessels, they could end up forming underneath the retina, detaching the retina, further impairing or even blinding me. So I had to get the laser surgery to touch up those vessels. I had this surgery a couple of times in the States. With Medicare, the surgeries ran me out of pocket, my 20% deductible. It was anywhere from $2,800 to $3,200 in America. Without Philhealth here in the Philippines, the surgery would have been 15,000 pesos, or about $300 a month. But with Philhealth, they paid for 8,000 of it. My final out of pocket was 7,000, or about $140. So I paid $140 for the surgery, as opposed to my out of pocket with Medicare in the States was right around that $3,000. So that's one advantage that I've gotten so far with Philhealth. My eye doctor has also informed me that I have a cataract in the right eye. I can eventually get this right eye fixed so I can actually see out of it, and the eye patch will switch. I'd be going seeing from the right eye, and I'd wear the eye patch on the left eye due to double vision. That cannot be fixed. But in any case, the cataract, she said that Philhealth would actually pay for everything except for the actual lens that's used to replace the cataract, and that would be 18,000 pesos, or about $350. When I got the cataract removed in my left eye, I had to pay for everything, but even still, with anesthesia even, it was 44,000 pesos, or about $880 at the time. When I tried to see about getting it done in the States before I came here, I could never get a doctor to give me an exact quote. I'm sure most Americans understand that. I was frustrated with it. But I finally got a receptionist at one doctor saying that it would probably be anywhere from $900 to $1,500 out of pocket. But the soonest they could actually get me in to examine the options was 6 months after I was scheduled to come here anyway. So I just decided to get it done in the Philippines. So that's the advantages of Philhealth, as opposed to, not having anything. Okay. The other thing about Medicare, I am an amputee, and I have a good prosthetic, and I needed to get some liners. I need to get some new liners. These items are used. I put my stump in here. This attaches to the prosthetic and allows me to walk. I'm sure if you've seen our videos, you've seen me waddling around like a penguin. Okay, so anyway, but this is what helps attach the leg to my stump. Okay, I need to get some new liners. These are starting to wear a little bit. I decided to call my prosthetic company in America, see how much they were going to be, and I might have had a chance of having somebody who's coming to the Philippines pack them and bring them to the Philippines for me, so I wouldn't have to pay for shipping. But here's the problem: you can't just go to a prosthetic clinic and get supplies when you're on Medicare in the United States. You have to go to a regular general practitioner, have a doctor look at you, say, yes, you need this, write a prescription, and then you take that prescription to the prosthetic clinic, and they can start doing the process of getting you the supplies you need. So there's always a middleman. There's the general practitioner, but it's with anything. If you got to go to an ear, nose, and throat, if you got to go to a urologist, everyone knows this, and they're frustrated with it. You can't just go to the doctor you need to go to. You've always got to go to a general practitioner. Pay the co-pays with that general practitioner. Then you get to go to the specialist, and then you're usually waiting for the specialist for anywhere from weeks to months to get your appointment, and it's total frustration. So in my particular case, I cannot get my liners until I see a general practitioner in the States. They will not accept a prescription from a Philippine doctor. They will not let me do video conference in order for them to get this appointment and get my prescription. I have to be there in person. Without insurance, this thing right here, out of pocket, no insurance, is $800. And I need two of them, a minimum of two. $1,600 out of pocket. And then I got to hope I can find somebody who can bring them with them to the Philippines. Otherwise, I've also got to pay for shipping costs and probably tax and probably import taxes because it's over 10,000 pesos. Okay. In Manila, when I first got here, I started calling about prosthetic clinics, and I found two different clinics, and I can get this out of pocket for anywhere from $150 to $175. I'm trying to find a clinic closer to where we live to see if they can't get them, so we don't have to go to Manila. But in the very worst case, we can make a 2-3 day mini vacation trip, see a prosthetic specialist, and get my liners in Manila. Okay. So after going through that mess with my prosthetic clinic, who was very sorry, I realized there is absolutely no reason why I even should have Medicare now, because I'm not returning to the States. Okay, this is me personally. I'm not returning to the States. If I would have to return to the States, I would be in a situation to where I could easily apply for Medicaid, and they would start taking care of stuff. My life would be a disaster. Basically, I'm not returning to the States. Some people would be like, well, what if you need some drastic, catastrophic, you develop maybe cancer? To be honest with you, I've resigned myself to if I develop cancer, and Philhealth doesn't cover what needs to be done, then maybe it's just my time to go. And I resigned myself to that. Okay, it's just my situation. Many people who come to the Philippines, they have family, they have friends, they can go stay with them. If they have, let's say they had to have heart surgery, and they can stay with their friends for 2, 3, 4 months, and they can go on. I don't have that. I don't have that support system. If I had to return to the States and go to the hospital, the day they release me from the hospital, I'd either have to stay in a hotel or I'd have to sleep in a car. I do not have that support system. So you're looking at a Medicare premium that is basically being wasted, as Noel mentioned at the very beginning of the video. So I've decided to go with the last, basically, nuclear option. I am dropping Medicare completely. You can do that. You can drop Medicare. Now, if you're going to drop Medicare, you need to know what you need to know. If you drop Medicare, and then for some reason you go back, the only time Medicare will accept you back without penalties is if you have a spouse or you have a job that you can prove paid your medical insurance. They will not accept out of pocket. They will not accept Philhealth. They will not accept any of the foreign insurances, for example, Pacific Cross, that is available for you here in the Philippines. Unless your job pays for your insurance or your spouse covers you, you will have to pay the penalties if you should have to sign back up. And that penalty is 10% per year that you did not have Medicare. So the example is, let's say 10 years from now, the Medicare premium is now $250 a month and you didn't have it for 10 years, your Medicare premium will be $500 a month. So it's a serious issue to consider whether or not you want to drop Medicare. If you finally decide, yeah, it's just wasted money, I'm never going back, like I've decided, I've been here 2 years now, I know I'm not going back. You can't use that money just to have more fun money, more beer money, more travel money. You need to take the money that would have been your premium and you need to immediately put it into an emergency medical savings. Whether it's just money under the mattress, you open up a second savings account, that's strictly what that's for, however you decide to save that money. Okay? You are looking at 8,000 pesos a month right now. In 1 year, you'd have 96,000 pesos. In 5 years, you are looking at somewhere close to 500,000 pesos, because if you keep track of how Medicare increases their premium and keep putting that amount into your emergency savings, in just 5 years' time, you should be over 500,000 pesos, which is easily $10,000. Okay? And in the Philippines, that's going to cover a lot of any major medical issues, probably short of cancer or severe stroke. And in just 10 years, you're now looking at over $20,000, and even $20,000 would cover a lot of the super severe, life-threatening illnesses. Okay, so basically that's what I have finally decided to do. I'm dropping Medicare. I put the monthly premiums into an emergency savings fund, and I pay everything. Then I pay all my medical costs here out of pocket. And so far, everything from my insulin to my doctor's appointments to finding my liners for prosthetics, so far everything has been cheaper here in the Philippines out of pocket than paying the deductibles in America with Medicare. So it's definitely doable on a lower Social Security income. But again, this answer is not for everybody, because I don't know your medical situations. I don't know what your story is. So I just wanted to give you the perspective of somebody who basically is on their own, other than his new family, his love and his family here in the Philippines, and what was going to be the best decision for me. So it's just something to think about. And if you have any questions, please leave them in the comments below, and we'll do our best to answer those questions. And if we can't answer them, we'll at least maybe turn you to a direction of somebody who can. That's about all I had to say about Medicare and Philhealth.
Okay. Yes, it's my turn. So that's it for this video, guys. Hope it will gonna help you. And if you have any questions, just write down the comments section. Comment down below. And then if you are new to our YouTube channel, please do subscribe and like this video. Like.
One last thing. Made this.
Jordan.
We made this.
Yeah, it's made of wood, and it's good wood. It's not cheap wood.
It's
made
wood. It's made out of Santa Clara marine grade plywood, painted with acrylic paint, and the backboard is made from a gloss spray.
Yeah.
So
So that's it. Thank you for watching, guys. Hope to see you again in our next video. Bye. By the way, all the links about Philhealth and ACR card, if you're interested, I'm just gonna put down the link below in my description box, and go ahead and check it out, and it might gonna help you also. Okay. Bye. 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 Bye.